Hi, it's Ray Gustafson, joined on the line by Dr. Mark Nikkel, orthopedic surgeon with Bronson Orthopedic and Joint Specialists in South Haven. Tell me a little bit about Dr. Mark Nikkel, a little bit of your background, if you would, please.
I'm a board-certified orthopedic surgeon. I did my residency in Chicago, Illinois. That was followed by a year of fellowship in sports medicine in California. I practiced in Chicago performing sports medicine procedures and minimally invasive joint replacement for approximately 15 years, and then have been in South Haven now for the past 4.
Well, that's great. So we want to talk about, and I've got some questions about advanced options for hip and knee pain. Now, I know my dad ended up having his hip replaced as he got older because of repetitiveness. What are some common causes of joint pain, doctor?
Well, I think you hit the nail on the head with one of the causes, the repetitive activity, the type of job that he or she may perform. Genetics is the number one reason. Usually, a patient comes in and they can't understand why they have arthritic disease, especially with no history of injury. I point to their parents or their grandparents, and that's typically another reason why. Further reasons would be tissue tearing, injuries at a younger age that resulted in arthritic problems and joint pain.
So what treatments are available to help a person cope with if they do have some joint pain?
So I try to make this really simple for patients. I hold up my hand, show my 5 fingers, and I say 5 fingers of treatment. The first one would be injections, typically cortisone shots. We can inject the hip under ultrasound guidance in the office, and patients show immediate relief for that. Shoulder injections, knee injections. Gel shots can also be performed. Those are shots that we give in the knee only, but they can be performed on a 6-month basis, and they can provide relief for the patient. Next, medications, typically over-the-counter or prescribed anti-inflammatory medications. Obviously, we take account what the patient's medications the patient is on already and don't want to cause any problems in that regard. Physical therapy is a mainstay for patients that have arthritic problems. Exercise is very important. In fact, that's the best treatment that you could do for arthritic disease because it restores motion and flexibility and decreases pain. Some patients require bracing, and so braces are provided. And then, of course, lastly would be surgical options if they failed all conservative management.
What if I've pretty much tried every non-surgical option available? What would be the next step for treating joint pain then?
Well, typically, I always ask a patient, I think one of the big questions patients have is, when do I know surgery is right for me, and when do I know it's time? And I always tell them, try to keep this simple again. Look in the mirror and be honest with yourself. If that particular joint is affecting their activity, things they enjoy, critical demands of their daily activities and their sleep, which is typically one of the things that brings patients into the office is they start losing sleep. When they get to that point, we talk about surgical options. For the hip, we perform an anterior approach. It involves using an interval with no cutting of tendons or muscles. With the knee, we perform a preoperative CT scan, which allows an engineer to create cutting blocks that we use intraoperatively. The size, position, alignment are determined preoperatively, and this allows us to bypass about 22 steps that a traditional knee replacement employs. It's safer for the patient and better for the surgeon. The minimally invasive nature of the procedures that we perform, along with the patient-specific instrumentation that we utilize, result in less pain and quicker recoveries. I have people that are traveling in about 4 or 5 weeks after hip replacement, and I have knee replacement patients that are golfing usually in 5 to 6 weeks.
Wow, that's impressive. Where can I go to find some additional information? Do you have a website, or do you recommend calling, or both, or what?
We have a website, bronsonhealth.com, or they can call our office, Bronson Orthopedic and Joint Specialists, and make an appointment at 269-639-2866.
Thanks for keeping us up to date.
You're very welcome. You have a great day.
You too.